Namaste. Hello everyone. 24th March 2021, World Tuberculosis Day. It brings memories of my teaching days where our professors used to tell us if you know tuberculosis, you know whole medicine. The theme of World Tuberculosis Day 2021 is the clock is ticking. We all know that the COVID-19 pandemic is in its second year and it's unfortunately taking increasing medical resources and attention away from providing necessary life-saving diagnosis, medicine and care to people suffering from other diseases, especially tuberculosis. Do you know tuberculosis is the biggest infectious disease killer in the world? If you want to look at some facts and figures, tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. There are some other variants of it called the atypical mycobacteria also. About 1/4 of the whole of world's population has a TB infection. Means we are exposed to tuberculosis. We may not suffer from the disease. Our lifetime risk of getting tuberculosis worldwide is about 5 to 10%. And if we are having some immunocompromised state, HIV, malnutrition, diabetes and smoking can increase the risk of contracting tuberculosis. A TB patient can infect 5 to 15 other people through close contacts in 1 year. Without proper treatment, 45% of the HIV negative people and almost all of those with HIV positivity would succumb to this disease. Every single day, 4,000 people die and 27,000 people get sick with tuberculosis worldwide. About 1.4 million people have died of tuberculosis in 2019. Even though tuberculosis is present in all countries and across all age groups, 8 countries account for 2/3 of the cases. Unfortunately, India contributes to the maximum number of cases. The biggest worry of late is multi-drug resistant tuberculosis. But please remember, TB is curable and also preventable. Someone asked for symptoms like it can affect almost every organ in the body, from skin to brain. It can also be localized or it could be disseminated. However, it most commonly affects the lungs, covering of the lungs called pleura, lymph nodes, abdomen, brains, bones including the spine, genitourinary tract, any organ you name it, and it can affect it. Symptoms therefore depends on the organ involvement. Commonly, if you're having unexplained fever, unexplained cough, especially lasting more than 2 weeks, weight loss, and certain symptoms like cough with occasionally blood coming out, please contact your doctors. Coming to the treatment, it is a multi-drug therapy. At least 4 groups of drugs are used initially. Total duration of treatment again varies based on where it is affected. It can be more than 6 months sometimes. We always educate and monitor for side effects. But please remember, TB is treatable. An estimate of 60 million lives were saved through TB diagnosis and treatment in 2019. Ending the tuberculosis pandemic by 2030 is amongst the health targets of United Nations Sustainable Development Goals. So please remember, the clock is ticking. Let's act and save lives. Thank you very much.